Hello, so welcome back to this another video where what we are going to do is we are going to cover the government schemes portion, and today we are going to cover Ministry of Health and Family Welfare's different schemes that we are going to see. Let us have an overview of which all schemes we are going to cover in this video. For our betterment, we should understand Ayushman Bharat Yojana, Janani Suraksha Yojana, Intensified Mission Indradhanush, PM स्वास्थ्य सुरक्षा योजना, राष्ट्रीय आरोग्य निधि, आयुष्मान भारत डिजिटल मिशन, नेशनल हेल्थ मिशन, नेशनल एड्स एंड एसटीडी कंट्रोल प्रोग्राम, आयुष्मान भारत हेल्थ इंफ्रास्ट्रक्चर मिशन, टेलीमानस, national sickle cell anemia elimination mission. So there are a total of 1 2 3 4 5 6 7 8 9 10 11 different schemes to cover in Ministry of Health and Family Welfare. Let us see one by one. Ayushman Bharat Yojana. To achieve the vision of universal health coverage by providing access to good quality healthcare services and reducing the financial burden on the poor vulnerables, thereby achieving SDG 3. The scheme is the christened form of National Health Protection Scheme, and it had subsumed Rashtriya Swasthya Bima Yojana. Launch year is 2018. Implementing agency is National Health Authority. Beneficiaries 10.7 lakh crore economically disadvantaged and deprived families were identified through socio-economic caste census 2011. Families already registered under Rashtriya Swasthya Bima Yojana. Components include your Health and Wellness Center and PM-Arogya Yojana. Health and Wellness Center. The scheme aimed to establish 1.5 lakh health and wellness centers by December 2022. These centers provide comprehensive primary healthcare services. They cater to maternal and child health services as well as non-communicable diseases. The first health and wellness center was set up in Bijapur, Chhattisgarh. PM Jan Arogya Yojana. It is the world's largest government-funded health insurance scheme. Provides coverage of 5 lakh for secondary and tertiary healthcare in empaneled public and private hospitals. Covers 3 days of pre-hospitalization and 15 days of post-hospitalization expenses. No restriction on family size, age or gender. All pre-existing diseases are included under the coverage. Provides 5 lakh rupees secondary and tertiary and 3 days pre-hospitalizations insurance. Implementation model: trust, direct implementation and reimbursement by state health authority insurance model. SHA pays the premium to insurance company and insurance company does the claim settlement. Mixed model. Funding pattern: 60-40. Union territories with legislature. Ayushman app. This app was launched for Ayushman card creation. State where the scheme is not implemented: West Bengal. Fine. So this was it for our Ayushman Bharat Yojana. Ayushman card also is available, right? I don't think so they have catered to that much in this PDF, but it is fine. We will see that in the coming moments. So next we have is Janani Suraksha Yojana. So let us see what is Janani Suraksha Yojana. To reduce maternal and neonatal mortality by promoting institutional deliveries among poor pregnant women. Launch year is 2005. It is a central sector scheme, 100% funded by central government. Low performing states: all pregnant women delivering in government or accredited private health institutions. High performing states: BPL women aged 19 years or above delivering up to 2 live births in government or accredited private health institutions. SC/ST women are eligible for both LPS and HPS without age or birth restrictions. Target group: poor pregnant women from BPL families and marginalized communities. Special focus on 10 low performing states. support for home deliveries. A financial assistance of 500 rupees is provided to BPL women aged 19 years or above for home delivery in both LPS and HPS, applicable up to 2 live births. Low performing states, high performing states. Okay. Financial support. Mother's package is 1400. Asha package is 600. So the total is 2000. In high HPS, 700, 600. Urban area, mother's package is 1000. HPS is 600. Asha is 400, 400. Okay, fine. So, a package of 2000 and 1400. That is it. Then we have intensified mission Indradhanush. Intensified mission Indradhanush seeks to boost full immunization coverage among children and pregnant women by focusing on unvaccinated and partially vaccinated population in low coverage areas. Launch year is 2017. Eligibility criteria: children up to 2 years of age, pregnant women requiring routine immunization. Focused on urban areas, migrant families, tribal population, etc. Phase-wise implementation. Focused on child and pregnant women who missed vaccines doses during COVID period. Targeting children under 2, coverage in 496 districts. IMI mission, intensified mission Indradhanush. Children up to 5 years of age, special focus on measles and rubella elimination. This was important. Okay. So that was it. Just one simple coverage for intensified mission Indradhanush. Let's move on to the next one. We have PM Swasthya Suraksha Yojana to address regional disparities in access to affordable and reliable tertiary healthcare services while enhancing facilities for quality medical education and research across the country. Launch year is 2003. Key features: upgradation of government medical colleges, cooperative federalism, comprehensive health coverage, establishment of new IIMs, setting up of 22 new AIIMs for improved healthcare access. Okay, that was it. Actually, we have just added this for the namesake. Swasthya Suraksha Yojana. Okay, fine. Then we move on to the next, that is Rashtriya Arogya Nidhi, to provide financial assistance to BPL patients suffering from major life-threatening diseases. Rashtriya Arogya Nidhi, 1997. All BPL families are eligible except government servants and their families. Families enrolled under Ayushman Bharat PM-ABHIM are not eligible. Components: Rashtriya Arogya Nidhi offers financial aid for BPL patients. Health Minister's Cancer Patient Fund provides financial assistance to BPL patients diagnosed with cancer. Then we have scheme for rare diseases, supports BPL patients. Okay. Financial assistance: revolving fund of 1 crore per component has been allocated to hospitals. Hospitals become eligible for replenishment once 75% of revolving funds are utilized. Medical superintendents can approve treatment up to 5 lakh rupees. For treatment exceeding 5 lakh, approval must be sought from the ministry. Maximum financial assistance permissible is 15 lakh rupees. Under National Policy for Rare Diseases, financial support up to 20 lakh rupees is provided under third component of Rashtriya Arogya Nidhi. So this is a very old scheme, but it is very important that per patient you can approve up to 5 lakh rupees without any problem, and maximum financial assistance to per customer or per patient is 15 lakh rupees. Okay. Then we move on to next, that is Ayushman Bharat Digital Mission. It aims to establish a robust digital infrastructure for the seamless integration of health data and services across India. It facilitates the creation of longitudinal electronic health record for every citizen to enhance healthcare delivery. Launch year is 2021. Implementing agency is National Health Authority, 1600 crores. Components: Health Facility Registry. Health Information Exchange enables secure sharing of health records with patient consent. Unified Health Interface ensures smooth interaction between healthcare providers, insurers, and patients. Healthcare Professional Registry centralizes verified data of healthcare professionals from various medical fields. Ayushman Bharat Health Account provides citizens with unique 14-digit unique ID to manage and share health records securely. Okay, that was it, I guess, for Ayushman Bharat Digital Mission. Then we move on to the next, that is National Health Mission. It aims to ensure universal access to equitable, affordable, and high-quality healthcare services that are responsive to the needs of all individuals, with special focus on underserved and vulnerable populations. Launch year is 2013. It has been now extended till 31st March 2026. Health systems strengthening, communicable disease control, infrastructure maintenance, reproductive, maternal, newborn, child and adolescent health, non-communicable disease control. Reduce NMR to 87 from 113, reduce IMR from 22, reduce U5 under 5 TFR, total fertility rate, achieve operationalization of 1.5 lakh Ayushman Bharat Health and Wellness Center, reduce prevalence of leprosy, annual malaria incidence, prevent and reduce mortality. Okay, ending TB epidemic by 2025 in the country. Fine. So that was it, and now let us move to next, that is National AIDS and STDs Control Program. Okay, fine. To prevent and control the spread of HIV, AIDS, and sexually transmitted diseases in India by ensuring comprehensive prevention, early detection, and effective treatment services. Launch year 1992. Target group: people living with HIV or AIDS, pregnant women for prevention of parent to child transmission, young and adolescent for awareness and prevention measures, general population for awareness campaigns and early detection. Phase 1, Phase 2, Phase 3. Phase 4 aimed at reducing new infections by 50% and providing comprehensive care to. Phase 5 focuses on ending AIDS epidemic as a public health threat by 2030 under UN SDG 3.3. Objectives of fifth phase: to reduce new HIV infections and AIDS related mortalities by 80% by 26 from the baseline of 2010. 95% of people who are most at risk of acquiring HIV infection use comprehensive prevention. Positive: no. 95 no statement. 95 those who are on treatment have suppressed viral load. 95% of pregnant and breastfeeding women living with HIV have suppressed viral load towards attainment of elimination of vertical transmission of HIVs. Less than 10% of people living with HIV stigma. Okay. Outlay for fifth phase is unit 10s, 100,000, 10,000, 15,000 crores. Goals of fifth phase: reduce annual new HIV infections by 80%, reduce AIDS related mortalities by 80%, eliminate vertical transmission, eliminate HIV stigma and discrimination. Okay, that was fine. And then we move on to Ayushman Bharat Health Infrastructure Mission, strengthening grassroots public health institutions to ensure delivery of universal comprehensive primary health care and critical care services, expanding and developing IT-enabled disease surveillance systems by establishing a network of surveillance laboratories, enhancing research on COVID-19 and other infectious diseases. Launch year 2021. 64,000 crores, 52,000 crores for centrally sponsored components, 9,000 components, centrally sponsored components, Ayushman Bharat Health and Wellness Center in rural areas, support for infrastructure development for 17,000 sub-health centers is proposed in 7 high-focus states and 3 northeastern states. Ayushman Bharat Health and Wellness Center in urban areas, support for 11,000 urban health block public health units, 730 integrated district laboratories in all district, critical care hospital blocks in all districts with a population of more than 5 lakh in state government and medical colleges district hospitals. Then we move on to the next, that is central sector components, critical care hospital blocks in 12 central institutions, support for 20 metropolitan surveillance unit, support for 17 new point care, support for 15 healthcare emergency. There is so much data, so much data. Biosecurity preparedness and strengthening pandemic research, support for setting up of National Institution of One Health, One Regional Approach platform, biosafety, virology. Okay. And there is just too much data in this, which is the scheme Ayushman Bharat Health Infrastructure Mission. Okay, too much data. Then we move on to Telemanas, mental health assistance and networking across states to provide free mental health services all over the country, particularly to people in remote and underserved areas. 2022 National Institute of Mental Health, Bengaluru. Okay. NIMHANS, technology support in International Institute of Information Technology, Bangalore, technical support, Indian Institute of Technology, Bangalore, and National Health Systems Resource Center. It includes a network of 23 mental health centers of excellence, 2-tier operational structure. Tier 1, state level Telemanas cells staffed with trained counselors and mental health specialists to provide immediate care. Tier 2, specialist and district level 24/7 toll-free helpline. 24/7 toll-free helpline numbers provide round-the-clock services. Calls are supported with 20 regional languages, ensuring inclusivity. Technology-driven services, automated callback system ensures every caller receives timely support, starting with trained counselors and escalating to specialists if required. eSanjeevani integration enables audio-visual consultations for cases needing more detailed evaluations. Mobile app provides a library of mental health resources, self-help tools, and video consultations. Okay. National Sickle Cell Anemia Elimination Mission, eliminate the genetic transmission of sickle cell disease by 2047, improve care and enhance the quality of life for sickle cell disease patients by reducing its prevalence. Launch year 2023, implemented in 17 high-focus states across India. Target and implementation timeline, screening of approximately 7 crore people over 3-year period. Coverage 0 to 40 years of age. Year 1 priority screening for individuals aged 0 to 18 years. Year 2 and 3 screening extended to the entire population up to 40 years. Okay, so that was it for Ministry of Health and Family Welfare. So yeah, if you like the video, please stay tuned and for more such videos. That is it. Thank you so much.